Vectra Cardiovascular Risk incorporates a personalized assessment of rheumatoid arthritis inflammation to predict a patient's risk of a cardiovascular event in the next 3 years. The Vectra Cardiovascular Risk test is appropriate for patients with rheumatoid arthritis, also known as RA, who are 40 years of age or older with no history of heart attack or stroke. Vectra Cardiovascular Risk has been developed and validated utilizing over 30,000 patients with rheumatoid arthritis. The Vectra Cardiovascular Risk test contains 4 sections. 1. The Vectra Cardiovascular Risk result. 2. The corresponding cardiovascular risk category. 3. The Vectra score associated with the Vectra Cardiovascular Risk result. 4. The patient's clinical information provided on the test requisition form. Let's go over these 4 sections. Section 1. The Vectra Cardiovascular Risk result. Vectra Cardiovascular Risk gives a patient's risk of having a cardiovascular event, such as a heart attack or stroke, in the next 3 years. This percentage risk is calculated using the Vectra score, 3 of the Vectra blood biomarkers, the patient's age, and the patient's clinical information provided on the test requisition form. An algorithm uses these values to generate the percentage risk, which represents the likelihood of the patient having a cardiovascular event in the next 3 years. Section 2 is the Vectra Cardiovascular Risk category. The Vectra Cardiovascular Risk result is categorized into one of 4 risk categories: low, borderline, intermediate, or high. Patients falling into the intermediate and high categories may benefit from evaluation and management of rheumatoid arthritis inflammation and other cardiovascular risk factors, such as diabetes and hypertension. Section 3 is the patient's Vectra score associated with the Vectra Cardiovascular Risk result. The Vectra score is a measure of 12 biomarkers adjusted for age, sex, and adiposity to generate a disease activity score. Low Vectra scores indicate a low level of inflammation and suggest the patient's RA is being well controlled by the current treatment plan. High Vectra scores, however, indicate a high level of inflammation and suggest that the patient's RA may not be responding to current treatment. Patients with RA have approximately 50% greater risk for cardiovascular disease compared to the general population. Patients with lower Vectra scores have a lower average cardiovascular risk. The 4th and final section of the Vectra Cardiovascular Risk result is the patient's clinical information. This section provides an overview of the patient's clinical information that was collected on the test requisition form when submitted by the provider. The clinical information includes the patient's age, diagnosis of diabetes, hypertension, history of cardiovascular disease, and whether they have ever used tobacco. This information is used in the calculation of the Vectra Cardiovascular Risk result. The Vectra score and Vectra Cardiovascular Risk result incorporate an assessment of patients' systemic inflammation to help guide management decisions. Add Vectra Cardiovascular Risk when ordering Vectra to help inform management of patients' cardiovascular risk associated with their systemic inflammation. Learn more at vectracv.com.